evening and welcome to Nurseline. I am your host, Barbara Winfrey. Tonight, we look at a condition that affects numerous numbers of American children who are disadvantaged. Gonococcal ophthalmia neonatorum affects newborns delivered vaginally to women with active gonorrhea infections, and the effects can be devastating. We go now to Nurse Mabel, clinical nurse leader and expert on gonococcal ophthalmia
neonatorum, also known as neonatal conjunctivitis, is an acute macropurulent inflammation on the surface and covering of the eyes in newborns, presented within the first 28 days of life. The Committee of Infectious Disease of American Academy of Pediatrics reports the most frequent infectious agents involved in ophthalmia neonatorum are chlamydia and gonorrhea. Gonorrhea is a microorganism that infects 28% of newborns delivered vaginally by women infected with gonorrhea disease. Clinical manifestation of gonorrhea ophthalmia neonatorum, also known as GON, includes periorbital edema, chemiosis, and purulent discharge. If left untreated, chronic infection occurs, resulting in vision loss and sepsis, which can include arthritis and meningitis. The United States Preventative Service Task Force gives a grade A recommendation that all newborns should receive prophylaxis for GON. The prophylactic agent should be instilled into both eyes of all newborn infants within the first 24 hours after birth. Erythromycin ophthalmic ointment in each eye in a single application is an antibiotic ointment recommended for use in neonates. The principal method of preventing GON is through screening of pregnant women. However, widespread screening is not recommended because gonococcal infection among women are frequently asymptomatic. The USPSTF recommends that clinicians provide gonorrhea screening only for sexually active women, including those who are pregnant and are at increased risk for infection. The USPSTF also does not recommend screening for gonorrhea in men and women who are at low risk for infection.
So who does this condition affect? We went to Sister Nurse Cleopatra, clinical nurse leader and head of the Inner City Maternal Clinic.
Here at the Maternal Inner City Clinic, we focus a lot on gonococcal ophthalmia neonatorum. This is a very, very huge illness that affects infants of the women that we treat. A lot of the women that we treat are low-income African Americans, Hispanics, and Caucasians. Most of these women are from the inner city and most of them are on Medicaid. But the problem with the Medicaid is these women have the opportunity, if screened early, to be absolutely gonorrhea free by the time they have their infants. But because the Medicaid does not go into action until about 3 or 4 months after the simple fact that they are pregnant, then the infection is not able to be treated in a timely manner to spare their infant of GON. The USPF recommends that clinician provide the gonorrhea screening for the sexually active women, including those who are pregnant or at increased risk for the gonorrhea infection. This may include women with previous gonorrhea infections, other STIs, or multiple sex partners, or even women who are inconsistent with the usage of condoms. Those who are in commercial, sex work, and drug users also have a high prevalence rate of getting gonorrhea and therefore can transmit the gonorrhea to the baby in the form of GON. There has not been any hard-on evidence to support the fact that there may be risk and limitation. Some have argued that prophylactic treatment of GON causes painful sensations for the baby and therefore limits the bonding time between the mother and infant. But once again, these interactions and these assumptions have not been supported. The USPSTF states that there's conceiving evidence that blindness due to gonococcal ophthalmia neonatorum has been rare in the United States since the implementation of the universal prophylaxis in newborn. And also, there's convincing evidence that universal prophylaxis in newborn is not associated with serious harms due to the infant. I am very pleased to be able to introduce you to a patient who allowed us to walk around with her and view her situation as she was a high-risk patient. We were able to direct her with the right care so that the prevention of GON to her child was prevented.
To understand how the nurses facilitate this intervention, we went to the clinic's expert on the health belief model.
The health belief model is one of the first theories developed exclusively for health-related behaviors. Health-related behaviors have 6 critical components, which include the person's susceptibility to that illness, the severity of a potential illness, the benefits of taking a preventative action, the barriers to taking that action, cues to action, and self-efficacy.
Miss Boudier?
Boutier.
I'm sorry, Miss Boutier. What brings you into the clinic today?
Well, my Medicaid just came through, and I've been experiencing heartburn, but I think I've got a little bit more thing going on here. I think I'm going to have a baby.
So this is your first prenatal visit?
I'm here now with a baby inside me. I don't know what that means.
I mean, is this your first time meeting with a healthcare professional about your pregnancy?
Medicaid just came through. I haven't seen a doctor. Probably when I was born was the first time.
Oh, okay. Well, according to your lab work and ultrasound, it appears that you're about 39 weeks pregnant. So you could technically go into labor at any moment.
Shoot. This thing,
Yeah, and actually, your STD screening came back positive for gonorrhea.
You saying I have the clap? Is that what the clap? I have nothing going wrong with me. There's no discharge, I have no pimples or anything.
Susceptibility is subjective belief that a person may acquire a disease or enter a harmful state as a result of a particular behavior.
Your blood work also tested positive for crack cocaine use.
Crack. I think my name was on that thing because, this clinic's busy.
Well, would you like to talk to me just a little bit about that? Your drug use, maybe?
Drugs, no. I mean, people have coffee in the morning sometimes, and, occasionally, once in a while, just to keep me a little awake in the morning, and I've got a tough job.
Perceived severity is the belief in the extent of harm that can result from the acquired disease or harmful state as a result of a particular behavior.
I feel fine. I have not been sick. Maybe tried a little crack cocaine, but, everyone's tried everything.
It's okay. Whatever you want to discuss with me today, you're in a safe place, and I just want to make sure that your baby is born in the healthiest condition possible. Okay. Why don't you tell me a little bit about your sexual history? Do you have a current or steady boyfriend?
I have a steady boyfriend.
Okay.
Yeah, I've been working with him for 3 years.
Okay.
Occasionally, sometimes to get a little business, I'm with his friends, but they're all clean. They're not gross guys. Again, nothing going on down there. They shower and stuff.
Well, that actually anybody can carry a sexually transmitted disease. Sometimes there's no symptoms.
Pimples and,
Sometimes there's no symptoms, so
nothing smells. Okay.
Right. So it's important to protect yourself every time because you never know.
Well, I'm pregnant now, so I don't have to worry about getting pregnant again, right? I mean.
Well, no, you can't get pregnant on top of your pregnancy.
Okay.
That is true.
Okay.
But because of your positive gonorrhea test, we definitely want to get you started on antibiotics after your baby is born. You're a bit too far along for us to start the antibiotics right now. And once your baby is born, in order to protect the baby, we're going to need to give the baby antibiotic eye drops.
I'm having a baby. I don't want to put anything on her. When this baby comes out, it hasn't had sex yet, so it doesn't need any. I'm the one that's having sex, so it doesn't need anything on him.
Right. I do understand your concern, but if we do not treat your baby, the baby could get a serious infection in the eye because of your current gonorrhea.
Perceived benefits are belief in the advantages of methods suggested for reducing the risk of seriousness of the disease or harmful state resulting from a particular behavior.
If you don't treat it, the baby could get conjunctivitis or some corneal scarring, or it could even lead to blindness. So it's just very important to take the necessary precautions, and we're going to ensure that the baby is born healthy, okay?
All right, well, I'm not going to give an address because I can't pay the bill for this. So, you can do what you want, but I'm not giving any home address.
Don't worry. Everything will be covered because this is a recommendation that came from the United States Preventative Services
I believe
Task
the government.
Force.
Yeah, the government's good.
Right, so this is recommended for all newborns, and it'll automatically be included.
Perceived barriers are the belief concerning actual or imagined costs of performing a suggested behavior. Cues to action are precipitating forces that make a person feel the need to take action, and self-efficacy is confidence in the ability to acquire the new behavior.
So fortunately, Ms. Boutier Boudier consented to the treatment, and mom and baby are doing excellent. Ms. Boudier's story is so common in an area like this, and screening for GON is crucial. However, evidence looking at the rates in the United States show low compliance, and it is up to us, the CNL, to make sure that this issue never goes overlooked.
Thank you, Sister Nurse Cleopatra. What an important topic for us to understand. And thank you for joining us tonight here at Nurseline. Tune in next week when we go undercover to investigate the roach infestation at UCLA School of Nursing.